Hello, this is Dr. Rhonda Johnson, and today is Sunday, August 30th, 2020. Today I'm going to be discussing acute pancreatitis and how that may be a new presentation of COVID-19. I'm also going to be discussing the results of a recent CBS poll showing differences among registered voters on how we're managing this pandemic, and I'll be talking about pandemic-related grief. But first of all, let's talk about acute pancreatitis. In a recent medical journal, it was reported that COVID-19 patients can present with symptoms mimicking those of acute pancreatitis. Now, what is acute pancreatitis, you're probably wondering, unless you're a healthcare professional or maybe you've had it yourself. Well, first you need to know what the pancreas is. The pancreas is a gland approximately 6 inches long in the abdomen. The pancreas has two key functions: digestion and regulation of our blood sugar. So acute pancreatitis is a sudden inflammation of the pancreas, and people who have this present with upper abdominal pain, which can be severe. Now, this study was a retrospective study. It reviewed charts of patients who had COVID-19 in a New York City healthcare system. The vast majority of patients presenting with acute pancreatitis as a presenting sign of COVID-19 were Black and Hispanic. So I share this to suggest with you that if you're experiencing sudden onset of moderate to severe upper abdominal pain, that this could be a presenting sign of COVID-19. And you need to see your doctor because acute pancreatitis needs to be treated, and it needs to be treated aggressively. Now, moving on. A recent CBS News YouGov poll surveyed 2,226 registered U.S. voters between August 19th and August 21st. And the results were interesting. Approximately 57% of Republican respondents in the survey said that the U.S. death toll for COVID-19 was acceptable, while 43% said it was unacceptable. Compare that to the Democrats, where only 10% said the coronavirus death toll in the United States was acceptable, while 90% said it was unacceptable. For independent voters, 33% labeled the death toll as acceptable, and 67% said it was unacceptable. Now, Republican respondents also differed among all voters on whether the U.S. handling of this coronavirus pandemic was going well, with 73% of Republican voters saying that the U.S. handling of the coronavirus pandemic was going well. And only 27% of Republicans agreed with the survey question that the pandemic was going badly. Republicans were the only partisan group of which a majority of voters said the number of deaths was acceptable. Now, perhaps this should come as no surprise to me, although it was, because after all, on August 4th, President Trump was interviewed about the coronavirus death toll, and he said, I quote, "It is what it is." Now, the United States has 24 to 25% of the world's total of coronavirus cases. We have more than 6.1 million cases documented, and 186,000 people have lost their lives to this pandemic. Now, when I read this poll, I thought of the words of Dr. King. There comes a time when silence is betrayal. Our lives begin to end the day we become silent about things that matter. Because I almost didn't want to report on this poll, even though the results of this poll sat with me for days and I was upset about it. But politics matter, clearly. And leadership in a pandemic matters, clearly. And again, I find these deaths unacceptable. They're not acceptable to me, and they never will be. And the numbers of the dying from COVID-19 are only going to increase the longer this pandemic continues here in this United States and across the world. And I believe and I know as a physician that we can do better, which is why I am using my voice to educate about this coronavirus, this deadly pandemic, and to the attempt to try to save lives. Which brings me to my next topic of discussion, grief. Grief is a term that applies to any reaction of loss. It can encompass a lot of reactions: physical, behavioral, psychological, social, and spiritual. Now, grief is not limited to the loss of people. It could be the loss of a pet or a job or anything that's important to someone's life. And many people feel grief over this pandemic and what I will call the loss of the yesterdays, whatever that yesterday means to you. So it causes you to feel some sort of emotion. And emotion is a natural response to loss. And the more significant the loss, the more intense the emotional response can be. Now, each of us responds to loss in a unique way. There is no right or wrong way of dealing with grief or loss. And grief obeys its own trajectory. And there is no timetable as to when it should end. I cannot offer any advice to you on how you should be feeling, or how I should be feeling, or how we should be feeling. In fact, if you attempt to suppress or deny your emotion, you may only be prolonging the process. So today, I want to encourage each of us who may be feeling an emotional response to this pandemic to acknowledge it, to give yourself permission to experience it. And I hope that you have someone around you that you can share your feelings with. Why am I talking about this? Because this pandemic has caused many people to experience grief and loss. And the twin pandemic of racism has caused people to feel intense emotions, and grief is one of them. So to acknowledge this, to try to do your best to work your way through it, is probably the best that we can all do right now. And I hope that if anyone out there is experiencing emotional grief and pain and loss, that you're doing okay. This is Dr. Rhonda Johnson. My views are my own. My only intent is to educate and inform. So stay safe, stay well, stay connected. Have a blessed day.